Hi everyone, I'm Dr. Elizabeth John and I am here to get my screening colonoscopy. It is to screen for colon cancer at age 50, and I just wanted to share this journey with y'all. Well, I turned 50.
Oh, happy birthday!
Thank you. And I kind of know that at 50 we try to screen for colon cancer.
Yes.
And so that's what I preach to my patients. And
Yes,
so
absolutely.
practice what you preach.
Yes.
So here I am.
Oh, that's
So,
awesome.
yeah.
Very good.
How is your feeling about the colon kits that come in a box to screen for colon cancer?
Okay, so it is a stool-based DNA test and it is approved. However, there is a risk of false negative. And if you have a positive test, you eventually have to get a colonoscopy. So the colonoscopy is the best available test for screening for colon cancer. What we say is seeing is believing. You know, colon cancer starts as a little bud or a little, the way I explain to people is that it starts like a tiny mushroom. And when it is in that, in that spot or that size, it's very easy to take care of it. And thus it's all preventable. So that's great. So do you have a family history of colon cancer?
No, no family history.
I see, okay. Do you have any symptoms?
No, I don't have any, no blood in the stool, no abdominal pain, no rectal pain, in terms of for the colon. I just got back from work and now I am going to start my whole prep, and it starts off with the Ducalax. So I have to take 4 tablets at one time. So here I am getting my Miralax ready into my Gatorade, and I ended up getting 2 different flavors just in case I just want to change it up, or I don't like the flavor of one of them. So this is a 238 gram bottle of Miralax, and I'm going to pour half in each one of these. And I put it in the fridge to make it cold, so they said that it might taste a little better. And then I'm going to go get a straw and then sip on it on one of the bottles. I'm going to sip on it till about 7 p.m. and then I'll work on the second bottle after that. So we'll see. Well, I tried pouring the Miralax directly into the Gatorade bottle. It overflowed. So I had to pour everything into this cup. Well, 2 different cups. So don't try to do that. Just put it in 2 big glasses and then divide it. Good morning, y'all. It's the big day. I can't wait to see what my results are going to be. Good morning.
So what we're gonna do is we're gonna get you into our room. We're gonna hook you up to an identical monitoring system. Once we get a full set of vital signs, we're gonna position you, which is gonna be on your left side. Once we have you on your left side, we're gonna introduce what's called a bite block in your mouth. It's a piece of plastic, has a hole in the middle, so when you fall asleep, we have access to your mouth. We can advance the scope. So we're gonna have you on the left side. We're gonna put the bite block in place, and at that point, we're gonna induce your sleep. Once we induce your sleep, what we're gonna do is gonna give you a medication called propofol. We'll wait about 20-30 seconds. You drift off to sleep. We start advancing the scope. Once we get inside, starting the colonoscopy, same thing. Any abnormalities, we're gonna take biopsies. Anything bleeding, leaking, or oozing, we'll be able to fix while we're in there. Once we exit the rectum, we'll get you over to recovery. You'll be there for about 30 minutes. Once you're fully awake, they'll start the discharge process.
Alrighty.
Any questions?
No.
All right. So once Dr. Maduri gets here, we'll get started.
All right, sounds good.
All right, I'll see you in a few minutes.
All right, thank you.
Thank you.
But that's the reason that we give a split prep,
Okay.
because they found that the closer to the procedure that you do the prep, the more cleaner the prep is, and thus it'll help us visualize the mucosa better. Okay? So, and again, think about it, it's just this one day you do the prep.
That's true.
And if we don't find anything, and if we get a very good look, then without any history of, family history of colon cancer, you'd be good for 10 years.
Yes. Hopefully.
Yes, yes.
All right.
All right. Well, here we go. Oh, y'all don't be scared. It'll be okay. It's needs to be done. You need to make sure that you don't have any polyps that could turn into colon cancer, and that's why I'm here to get it evaluated.
Yes. Yeah. We're here.
Go ahead. Okay, now we've reached the end of the colon, or we actually say the beginning of where the colon is, called cecum, and it looks very good. The prep is actually excellent. I can see the lining very well, and so far the colon lining looks very good. I'm taking my time to look at the folds of the colon and behind the folds, because there could be sometimes polyps behind the folds. There's a very small polyp here, looks very flat. Again, I'm only able to see it because the prep is very clear. Okay, so as you know, this is very important for us because colon cancer is the third most common cancer in the US and the second leading cause of death. And so in a colonoscopy, we try to find these polyps and we remove them so we prevent from cancer formation. And so far I found just one very small polyp that we took out. The rest of the colonic mucosa looks very good. Hi, how do you feel?
I'm okay.
Okay, great.
I survived.
Yes, you did good.
Good.
So your procedure went well.
Okay.
Okay, and you did an excellent prep.
Okay, good.
You did a very good job. The
Oh,
prep was
good.
excellent. I had a very good look.
Okay, good.
Everything looks good. I did find a very small polyp that we took out.
Okay.
Okay, and we sent it to the lab.
Okay.
Okay, so we'll wait for the biopsy results.
Okay.
Okay, and depending on what the results come back as, maybe you'll need another colonoscopy in 5 years.
Okay.
Okay,
All right.
but we'll see depending on the results. Otherwise, everything went well.
Good.
Okay, I just
Good.
found like a couple of diverticula,
Okay.
but literally I only saw them because your prep was good.
Good. Excellent.
Okay, so you had your colonoscopy and we found this polyp and took this out. How do you feel about that?
I'm actually very glad that I ended up, taking my own advice that I give to my patients and, starting this process when I turned 50. And the fact that I had a precancerous polyp, that gives me some relief that, I'm catching things on time and trying to prevent colon cancer from forming. So I'm definitely a big believer in the screening colonoscopies, and not only am I going to keep continuing to preach this to my patients, but as well as to family and friends.